Hi guys, welcome to Time with Baby. On this channel, we talk about important health issues concerning women, and secondly, we talk about issues concerning men and children. This is a series I've entitled Mama's Guide. We are going to talk about certain things you should know about pregnancy so that throughout the pregnancy process, you'll be able to do what is right when it's right. So today we're going to talk about three common questions women ask about antenatal care. Before we delve into today's video, don't forget to like, comment, share, and subscribe. So question number one, what is antenatal care? So basically, it is the care given to pregnant women throughout the pregnancy. So from the beginning of the pregnancy to the end of the pregnancy to ensure that the process is smooth and also to enable us identify certain issues or health conditions and manage them appropriately, since these health conditions can have adverse effects on the mother and on the baby if not well managed. Question number two, when should I start my antenatal visits? Normally in our setting in Ghana, some people tend to wait till a certain period before they attend antenatal clinic. Some people have the notion that the first 3 months of the pregnancy must be kept from people, so they tend not to go for these antenatal visits and tend to report after the first trimester. But I want you to know that your first ANC visits should be as early as within your first trimester. I would encourage that the moment you realize you've missed your period or you do a pregnancy test at home and it's positive, just go to the hospital, see the midwives, and they'll take you through the necessary process and when you can start antenatal clinic. Question number three, why is visiting antenatal clinic important? Well, we'll talk about just a few of them. But visiting the antenatal clinic, as I said initially, helps us go through the pregnancy journey with you. It also helps us identify certain risk factors that might be detrimental to your health and to that of the baby and help us manage them appropriately. This is how the Maternal and Child Health Record Book of Ghana looks like. In it, we take your details, your demographics, certain risk factors that you may have, family history, birth history, and all those things. And these enable us manage you. During the antenatal visits, we do certain laboratory investigations. For the first visit, we check your full blood count to know your hemoglobin level or your HB level. It also helps us to address any issues because in the pregnancy you need a good HB level for your baby to get enough oxygen as well as yours to get enough as well. Also do a sickling test and enable us to identify whether your genotype AS, SS, because all these tend to come with different complications in pregnancy, especially those with genotypes SS, and SC. We also do HIV tests to enable us to identify children who are at risk and also help us to put measures in place to prevent mother-to-child transmission as early as possible. We do hepatitis B, hepatitis C test to enable us to identify babies who are at risk as well and put measures into place, enable them to receive the vaccines and immunoglobulins right after birth. We do syphilis tests in the mothers, and when these are positive, we tend to treat the mothers and also tend to give the babies medications when they come out to prevent further complications in the future. Urine tests are done to identify the presence of any infections or urine proteins or anything that might be detrimental to the health of the woman. Ultrasound scans are done in the first trimester, and these are very important to enable us to identify whether it's a true gestation, it's a true pregnancy. Also, throughout the pregnancy, you do repeated ultrasound scans, you do growth scans, you do anomaly scans, and these enable us to monitor the growth of the baby and to identify any issues as early as possible so that they can be addressed. Your blood sugar level is also checked from time to time to enable us pick up any gestational diabetes and address it, since it also tends to have detrimental effects on the children, tends to expose them to certain congenital anomalies, also can cause fetal death. So if this is identified early, it can be managed appropriately and these can be avoided. Blood Pressure measurement is also important because some pregnant women tend to develop hypertension in pregnancy, which also tends to have adverse effects on the baby and on the mother as well. So when this is picked up early, we tend to manage it appropriately and prevent these adverse effects. Pregnant women are also given prophylaxis against malaria because with pregnancy, your immune system is quite down and the risk of having severe malaria and its complication is very high. So you receive the prophylaxis against malaria since we tend to be in a malaria endemic society in Ghana as well. We also tend to give the tetanus toxoid to pregnant women. Other things that pregnant women receive are folic acid and iron supplements. These are all important to the mother and to the baby. So our take-home message from this video is to have a healthy mother and a baby at the end of every pregnancy. Please report for early ANT booking, be punctual and regular, and be a compliant client. Because during these ANT visits, we'll be able to identify any risk factors present and manage them appropriately. Until we meet in our next video, I would like you to share, like, comment,